Hi, my name is Ed Kelley, coordinator at the WHO Patient Safety Program, and I've been asked to join you today to talk about one of the most important topics in patient safety and quality improvement, leadership. Now, unfortunately, leadership, while being one of the foundations for health system strengthening, is also one of the least invested in and the least understood topics that we have. At the WHO, one of our core roles is convening for health and convening for setting the leadership agenda in global public health. So when we started out early in the WHO patient safety program, we looked to provide leadership around patient safety and quality improvement. And we started with a global patient safety challenge, and after major success with over 14,000 hospitals engaged globally, 125 countries around the world signed up to do this. We went back and looked at what were the factors that made a difference in this incredible campaign that we had. And one of the key factors that we identified was charismatic leadership. Now, leadership, if you look at the literature on it, there are a whole range of definitions, but basically it comes down to organizing people to do a job. And the theories of leadership, you can go back to looking at charismatic leaders, starting with Caesar, Napoleon, other leaders. And the theory used to be that leaders had these important attributes. They were born leaders, and there was nothing to do about it besides that. You couldn't coach leadership. Subsequently, situational context and the importance of the team that the leader works with became more prominent in the literature, and the idea that different modes of leadership would be important is something that in healthcare has become extremely relevant. There's no way that a clinical team working in a high pressure emergency room environment will be led in the same way as a large global public health program. Now, the issue that we have now, if everyone agrees that leadership is important, is how to encourage and nurture leadership. Well, at WHO, and particularly within the patient safety program, we believe that there are two aspects to this. First of all, you have your existing leadership that's out there, and we need to challenge those leaders more. We need to work with them to provide the data and evidence that they need for decision making, and then to use that data to create what people call, and what we at WHO have termed a burning platform for improvement, to really set a stage that without a particular improvement effort, major issues will occur, patients will die, and costs will be incurred. The other aspect is involving senior management. Now, we've worked in improving bloodstream infection and in other clinical improvement programs where, with colleagues at Johns Hopkins, the daily involvement of senior management within a hospital is extremely important, and that bringing them on board with simple tools allows for major improvement to be spread. And creating a policy mandate is another piece of the puzzle. This policy mandate can come about in terms of strategy, national strategies, in terms of national programs, legislation, or a global challenge like the one we had. Now, the second aspect I was asked to address with the leadership question is how can donors and international partners do more? For sure, there's a major gap that exists right now. Donors working in international public health are not doing enough, and WHO, as an international partner in that, is also not doing enough. We don't build leadership in as a result we're expecting from projects we develop. We don't talk about it in our memoranda of understanding, and we don't put it in our requests for proposals. That needs to change if we're going to really strengthen health systems. The issue that we have is that we haven't developed enough the idea of identifying and mentoring up-and-coming leaders. The Gates Foundation, for instance, had a major program, the Management Leadership Initiative, looking at identifying those mid-level leaders and mentoring them to come along. We also need partnership programs that put leadership at its core and developing new leaders. Our African Partnerships for Patient Safety program does that and works to develop leadership as part of a hospital partnership program between European and African hospitals. Now, I'll close with a few challenges that I think need to be addressed by all of you out there, as well as by WHO. Part of the issue in healthcare is that we haven't figured out how to show the business case for leadership. What is the return on investment for leadership? We don't know how to measure its input, so it's certainly hard to measure its output, and that's research that we really need to advance. Secondly, in the information age, leaders need to be masters of information coming in and information going out. They need to have information in order to make good decisions when they need to make those decisions. And they also need to be able to manage the information going out, to motivate staff and to improve care through major campaigns like that. Thirdly, the last challenge I have for you is that we have not adapted the lessons from other industries, particularly the business sector, to create the competency models for leadership and to be able to train people in leadership. WHO Patient Safety Program has developed training programs and research methods, as well as a major multi-professional patient safety curriculum guide that trains and develops our future clinical leaders in aspects of patient safety and quality. We need to expand that into the management arena and to be training the next generation of healthcare managers as well. Well, those are a few of the thoughts that I have on leadership and the challenges that we have with them. WHO and its partners will be exploring these at the Salzburg Global Seminar the week of 22nd April in Salzburg, in collaboration with USAID and others working there. And we'll, of course, continue to explore these issues online with your input at isquaknowledge.org and at who.int/patient safety. Thanks very much for listening.